Hi guys, it's me, Professor D, and welcome back to my YouTube channel. This video is going to be slightly different. So I'm not teaching on this video. I'm actually going to be um, providing a list to you. So this whole year, I've had hundreds of students that would either leave me messages in the comments or send an email or through my website, letting me know that they passed their Nclex and letting me know certain topics that I talked about and how they saw it on the Nclex, and just basically thanking me for my part in their educational career. So what I did this weekend, I took the time and I went through dozens and dozens and dozens of those correspondences, and I made a list of the content that I've been seeing over and over. Now, mind you guys, I get students to take Nclex all over the country. So this list I'm about to give you, it's not for any particular state. It's, like I said, all over the country, but there are certain topics that I kept seeing over and over and over again. And I promise every single topic, after I see it for the 6th, 7th, 8th time, I'm starting to get so excited. So I'm going to read off this list to you as I have it. And the reason I'm not sharing my screen, you guys know how horrible my handwriting is. There's no way that you guys would be able to read this. So anyway, I'm going to list it off to you. The first one is aminoglycosides. That has been seen a lot. So remember your aminoglycosides like vancomycin, and you need to know that the adverse reactions, remember, they're very hard on the kidneys. They're very hard on the hearing. So you're going to assess the patient's hearing. You're going to be looking at that BUN creatinine urine output, all that good stuff, right? Next, students said they saw, I got a lot of students that saw preeclampsia. I don't have details on preeclampsia, just preeclampsia. Next, consent. Specifically, who can give consent and who cannot give consent. Nursing intervention for seizures, such as safety, making sure that the patient doesn't harm their head, making sure that the bed's in lowest position, that type of stuff. Next, signs and symptoms of hypocalcemia, right? Such as tetany, Chostek's-sign, Trousseau's. Next, nursing interventions for diabetic ketoacidosis. Next, lots of priority and delegation. This is what I saw the most. I should have counted, but I didn't. But this is what I saw the most. Most of all of the emails and correspondence that I was getting, all of them included priority and delegation. What type of patient must the RN keep? What can they delegate to the LPN or LVN? What can they delegate to the UAP? What patient is a priority? What patient are you going to see first? That type of stuff. That was the running theme that I saw the most for all 2022. Signs and symptoms of appendicitis. Nutrition for acute renal failure. So what type of diet's that patient going to be on if they have acute renal failure? Acute renal distress syndrome. And that's all I have. Like, nobody specified what, is it nursing intervention? Is it education? So make sure you know everything about acute respiratory distress syndrome. Next, spina bifida. How are you going to position the patient? Next, DIC. What does DIC stand for? Disseminated something coagulation? Hold on. Because that's all I wrote, DIC. What does DIC stand for? Give me 1 second, guys. I'm going to look it up because I can't remember DIC. DIC. Disseminated intravascular coagulation. So anyway, guys, DIC, remember, that's when the patients, they're clotting a whole lot, then they're bleeding the whole lot. Then they're clotting a whole lot, then they're bleeding a whole lot. So depending on where that patient is in the DIC process, you need to know those nursing interventions for that. Next, abruptio placenta, dehydration, placenta previa, complications of sickle cell disorder, such as blindness, hyperglycemia, when the anterior fontanelles close, substance abuse disorder, insulin, when to give what types of insulins, Burns rule of 9, pediatric milestones, Aspirin, who not to give aspirin to. Command hallucinations. Don't forget, command hallucinations are the most dangerous type of hallucinations. Oh, the math that they saw, drop factor. Next, fractures. SSRIs, MAOIs, TCAs. Make sure you know those antidepressant medications. Pneumonia. Nursing interventions for the different types of phobias. Sulfa drugs. And when I say sulfa, I'm talking about SULFA, sulfa drugs. Alcohol withdrawal, the nursing interventions for alcohol withdrawal. By the way, alcohol withdrawal is deadly. Schizophrenia, COPD, the nursing interventions for opioid overdose. Make sure you guys know about Narcan as well. Hypertension, cor pulmonale, insulin pen, hyperthyroidism, epinephrine administration, and the adverse effects. So there are lots of questions about actually administering the epinephrine, like where, I am, and knowing the adverse effects of epinephrine. Isolation precautions, the different types of isolation precautions. Antidote for heparin, protamine sulfate. Cushing's, how to administer iron IM. So they got questions on the Z-track method. Make sure you know those steps. Patient teaching for gestational diabetes. Nursing interventions for hyperkalemia. Nursing interventions for de-escalating patient. Okay, so a patient's ready to fight or become violent. What are your nursing interventions for de-escalating the situation? S3 heart sounds. When you see S3 heart sounds, what are you guys thinking of? CHF, so make sure you guys know about this. Nitroglycerin. ACE inhibitors. Signs and symptoms of DIG toxicity, digoxin toxicity. You need to know those signs and symptoms. Risk factors for heart disease. Beta blockers. You need to know about beta blockers. You need to know the nursing interventions for peritoneal dialysis. Signs and symptoms of diabetes insipidus. And remember, diabetes insipidus has nothing to do with diabetes mellitus. Diabetes mellitus is when your blood sugar is too high. Diabetes insipidus is when you're urinating all over the place because you don't have enough antidiuretic hormone. So don't mistake those two. Next, bipolar disorder. Patient teaching after thyroidectomy. Patient teaching for immunocompromised patient. Like teaching them to stay away from crowded places. They're not the types who can go to concerts, stuff like that. Parkinson's disease, safety teaching for Parkinson's disease. Nursing interventions for intracranial pressure, for increased intracranial pressure. So, you're going to teach a patient not to do things that can increase the intracranial pressure, such as coughing, sneezing, bending at the waist, stuff like that. Next, risk factors for chronic kidney disease. Signs and symptoms of Guillain-Barré syndrome. Antidote for Coumadin. Nursing interventions for SIADH. Glaucoma. When to give mineralocorticoid for Addison's disease. Next, the Glasgow Coma Scale. Signs and symptoms of lithium toxicity. And you know what? I didn't write this on the list, but something else I saw a lot of, not only the signs and symptoms of DIG toxicity, I saw a lot of just knowing the levels, the DIG levels of the normal level and the toxic level. When to suspect autonomic dysreflexia. So if the patient had a spinal cord injury, obviously, right? So usually the question in the body of the question, they'll tell you that the patient had a spinal cord injury. And then you'll see those other signs and symptoms. Okay, what's next? When to, no, I talked about that. Reportable. Oh, when to report and certain things to report. This has been seen I saw this a lot as well, like things you report, child abuse, certain STDs such as gonorrhea, chlamydia, STD, gonorrhea, chlamydia, HIV. And usually you really don't have to report it, because once it goes to the lab and the patient has that diagnosis, it's immediately reported to the state. But you have to know which diagnoses are reportable, what has to be reported to the state. Tuberculosis, stuff like that. Difference between type 1 and type 2 diabetes. Post-op care for a patient that's had cataract removal. Treatment for digoxin toxicity. Signs and symptoms of compartment syndrome. Remember our 6 Ps that I can never remember all 6? Let me see if I can remember. Paresthesia, paralysis, pallor, pain, poikothermogenesis, and what's the 6th one, guys? Pain, paralysis, pallor, paresthesia, poikothermogenesis. I can never remember the 6, but anyways, there's 6 of them. Make sure you know it. And that's it. So all in all, this is a list of 75 things that have been seen over and over and over and over and over on Nclex, and this is all over the US. And the reason there's only 75, like I said, this has repeated itself many times. So this is a list. I hope this was helpful for you. I don't write the exam, guys, so I don't know what's on it, but it's always helpful to know what other students have seen, because it might give you an idea. Oh, you know what? I never really studied about that. Let me go read about it, just make sure that I know. So everything that I mentioned on this list, I highly encourage you just to make sure that you know about it and you understand it. Short and sweet. So guys, don't be upset with me. I would tell you, let me know what you think about this video, but I know you may be upset that I wasn't able to help you more, but that's all I got. And again, I don't write this exam, but I was hoping this would be helpful for you. If I mentioned anything on this list that you're not comfortable with, or you feel like you don't know enough of, before you go take your test, go review it. Go back in your test book or read about it. And if you still don't understand it, let me know in the comment section, and I'll try my best to get a video out there for you. And a couple more things. Don't forget to like and subscribe to this channel. Thank you again, guys, for getting me to 100,000. Thank you, thank you, thank you, thank you so much. And I have audio lessons available on my website, nexusnursinginstitute.com. Thank you for watching this video. You guys will catch me on the next video.